first one. I'm going to pinch my finger, put it on your top lip. I'm going to spread it. I'm going to pull it together, and I'm going to pull down real gently. I'm going to do it 3 times. Oh, you've done a nice job with this. Pinch it, spread gently, pull it together, pull down. 1, 2, 3. Hold each one 3 seconds. Then I'm going to contour my finger to his top lip, and I can feel the bone underneath very gently, moving it to one side, the other side. I'm going to do it 3 times on each side, so it'll be to 6. That'll stretch all that tissue up on the top lip, get the top lip more active, and get strength and length to it. We're going to do the bottom lip, go in and pinch, spread, gather. Whoops. And anytime it's wet, you're going to have to dry it, Trey. How's that lip doing, fella? Looking good? Okay, we're going to put it in, spread, gather up, up. 1, 2, 3. I'm going to dry my hand. Come in, spread, gather up, pull up. Pulling the bottom lip up so we can have good closure, won't have the drooling. And so you can have his lips ready to make the sounds of the lips. 1, 2, 3. I'm going to make the same exercise on the bottom as I did on the top, where I contour my finger, go to each side. 3, 4, 5, 6. You like super champion exercise, boy. Okay. The next one, we're going to do number 5. To get the corners of your mouth, I'm going to place this finger on top, this one meeting at the first knuckle. We're going to go in opposite directions. And I keep my fingers shaped to the shape of his lips, so that we get in that we're on the muscle fibers in that same direction. And we do it 3 times each direction, so we'll go 6 of them. Okay, nice job. Now we've done the corner, so now let's go all the way around the mouth. We're going to pretend it's like the face of a clock, and we're going to do exercises at 10, 12, 2, 4, 6, and 8. First one, we're going to do a lateral movement of the lip, where I come in, put my thumb on top, and just one finger goes, the finger goes one direction, the thumb will go in the other, just to separate that tissue. I'm going to go 1 time in each spot. The lip muscles are weak muscles, and we don't want them to overstretch. I'm going to go around 3 times. Okay. Alright. Boy, you're getting some tough lip muscles. Next time, let's curl them out. We'll go in at 10 o'clock. 1, 2, 3. 1, 2, 3. 12, 2, 3. Then we're going to curl down, because we're going to do this one. Trey, we're going to have it for you like your ooh sounds. Say you, boo, and boo. And those lips will be able to curl really nicely. Okay. As I change hand position, I make sure that my hand's not wet. A lot of kids can't stand the way that feels. Okay? And also it'll slide. Now I've already lost count. Miss Irene loses count a lot. But we'll go on to the next one. That's the curl out. Now we still need the lips to do something else. They got to curl in so we can go mmm and puh and buh. And we have to have good strength and pressure. So we're going to stretch in. 1. And we'll go towards center, so we got a good pursed lips. Okay. It's gonna feel good to you, Trey? Trey's unlike most kids in that he has liked his mouth exercises, and most people when they first start have a lot more trouble. If you think about common sense that you want the lips to come together, and this is just a good little program to get them coming together. All right, next thing is we've got our lips going out. We've loosened up the tissues. We've gotten all the length in the lower lip, top lip. Now we want to get some strength. And so, Trey, I want you to close your lips like this. Close your lips, and Miss Irene's going to pull them away. Don't let me pull them. Oh. I'm trying to lift the lip. Don't let me. Hold tight.
Pucker.
Pucker. Ooh, I can't get it. Try it again. Don't let me get it. Hold tight. Pucker. Pucker. And so I'm going to get right on the pink and push up, giving a quick stretch. And I'm going down. Again, they're going to be at 10, 12, 2, 4, 6, 8. I go around 3 times. Pucker. Pucker. Good. Pucker. 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 Good. Pucker. 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 All right. Nice job. All right, you've done all your lip stretches, but now we got to get your mid-face tray. You know what a mid-face is. That's all around your nose, up between your eyebrows, and so the bridge of your nose can get some of your glasses stay on there a little better. The first one we're going to do is where our fingers go in a diagonal motion up and away. I'm looking for white lines. I make sure all this tissue is stretched right in here. 1, 2, 3. 1, 2, 3. 1, 2, 3. And so the skin will hug the nose real nicely. I'm going to do the opposite direction. 1, 2, 3. 1, 2, 3. 1, 2, 3. Next exercise, I'm going to put one across the forehead, one on the upper lip, and we'll go side to side. 3 in each direction, so we're going to do 6. And again, we're going to look for the little white line in here. Whoops. Nice job. Next exercise, I'm going to give some, bring all this over and around. So I'm going to act like I'm drawing a number 2 right here. I'm going to do it on both sides. So I'm going to go out and around, bringing all the tissue up to here and back out. All these exercises are done very gentle and hold. I'll repeat 3 times. And this is going to loosen up all around the nose and around, and work the lips too. Nice job. Very nice job. Okay, we got to go inside the cheeks. 14, 15, 16, 17. We're going to do them as a set. Oh, I'm sorry, I might have skipped something. Probably skipped number 13, which was gum massage. Oh, 12 and 13. Let me check number 12. Okay, I'm going to put my hand right at the corner of the eye, lifting up on that tongue and jiggling it forward. I'm going to do it 3 times. Just to lift the base of the tongue, and I also get, you can just do it 3, but I put it up the whole side of my hand, lift up to the bone on each side of his jaw, and then jiggle forward. Good job, Trey. I might add that one on. Okay, the next one we're going to do gum massage. I'm going to put my finger on each tooth right above it, give pressure, and move about a second of pressure. I'm going to go all the way around to the back. This is a very inhibitory exercise for touch. And give it to his tolerance. I switch hands so it'll be comfortable for him and for me. And I keep going around. If you don't tolerate this, you can always use a whole finger of pressure, or you can slide. Do the amount of pressure that he likes. If it's really deep, you have to hold longer than a second, that's fine. But trying to get input in so he'll be more aware in his mouth. Drool control and just tolerating the input to the mouth. You always start at the center and we go in a clockwise direction. We want it to be an organized approach so he knows what to expect and gets ready. Nice job, Trey. I'm going to dry your mouth and my hands. That's a good job. Next exercise is 14, 15, 16. And 17, we're going to do them together.
I got those gloves on.
I got those gloves on. You love gloves, don't you? All right. Miss Irene's going to stretch this cheek. And what we want to do is I'm going to go in right here, and I'm going to have my fingers pressed together, not tips, but as much surface area as we can try. And I'm going to slide back, doing like a C shape, coming back toward the ear, to the back of the jaw. Coming around and up, bringing that lower edge of the bottom lip up. 2, 3. We'll go again. Where I come, squeeze it. If the skin gets a little resistant, you might put some cream so it doesn't chap. 1, 2, 3. Nice job. Okay. Around. And 1, 2, 3. Okay. I'm going to give stretch from the back, from the ear to the jaw. 1, 2, 3. And slide forward. Go to number 15. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, And when we do the upper cheek, we're going to come around and up and across the nose. 1, 2, 3. Up, around, and across the nose. 1, 2, 3. Up, around, and across the nose. 1, 2, 3. Stretch from the upper part of the jaw. Stretch and hold. 1, 2, 3 each time. Let's do 3 of them. I was too fast on those. Okay? Nice job. We're going to do the same to the other side. Okay, I'm going to go in. And I probably got this reversed on this end, and I should have done the bottom first, but that'll be alright. Okay, go around and up. 1, 2, 3. Go around and up. 1, 2, 3. Go around and up. 1, 2, 3. Trey, you just wonderful. And then we're going to hold back at the ear and pull forward. 1, 2, 3. Gather back, forward. 1, 2, 3. Forward, gather back. 1, 2, 3. I'm going to start back down here. Go up and around. 1, 2, 3. Up. Doing that C shape with a gentle stretch. 1, 2, 3. Just like we did on the other side. Up and around and hold. 1, 2, 3. Then we'll pull back. 1, 2, 3. Pull back. 1, 2, 3. Pull back and forward. 1, 2, 3. Pulling just so you give him length through here. So good job. Next exercise, I'm going to go into the cheek, find that little pocket, and I'm going to give a little bump where I just do the end of my index finger to give a quick stretch. I'll give him 3. Good job. And the other side is to get those little muscles on the side a little bit more active. Nice job, Trey. Okay. Trey, we got to do our old handy dandy nook brush now. Boy, look at there. Look at those little chomping teeth. We're going to go up to the back molar. Give pressure up. 1, 2, 3, 4, 5. Make sure your hurl is stable. Put your hand against his face so you don't slip and go at an angle. And go to the other side. 1, 2, 3, 4, 5. Make sure you stabilize so you're not yanking. And he feels that pressure. This is very inhibitory to the mouth. Also, so children like to chew, and also it helps with learning to chew. You have him chew the brush. Can you chew that brush, Trey? Chew it. Chew with me. I like his chewing gum. We'll work on it later, okay? All right. Next thing we got to do. Oh, we got to see what Mr. Tongue can do. Oh, me. We're going to act like we got a button up here on the top gum, and we're going to give it a slight push, and then we're going to push that tongue, then we're going to come to the cheek, open up again, open up, and I'm going to push Mr. Tongue about 1 inch, then I'm going to come to the bottom gum and give it a touch. All right, we go into the first switch. Boom. Open up. I'm going to push Mr. Tongue about 1 inch, about in level with the, in line with the eye, see if the tongue will follow. Go to the cheek, open up, push that tongue about, oh, I lost it that time. Tongue about 1 inch, okay. And come back, and I'm going to push down here and see if it'll follow. Okay. He's not following today. I want to get so that he can follow, and that's a reflex of the mouth. Okay, I'm going to give slight pressure on his upper gum, open up, push. Pressure on his cheek, open up, push. Slight pressure on the lower gum, open up, and I'm going to push. Good. All right. Trey, I'm going to see if I can get a little bit more under with you because we got to get this active. Okay, I'm going to get pressure. Open. Mr. Tongue, I'm moving you. Move over and let me in, he said. Mr. Note Brush, I'll give a little pressure. Open up, open up. Move over, Mr. Tongue, and let me in. I was trying to get his seat. I'll put pressure on the bottom gum. Open up. Give pressure. Oh, move over, Mr. Tongue. Okay, let's try to get on the other side. Bump, 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 bump. I'm going to give a little bit different for him. Okay, open up. And move over, Mr. Tongue. Okay, open up, move over, Mr. Tongue. And down here, and move over, Mr. Tongue. Good job, Trey. You are fantastic. You're about the best teacher I have ever seen in my life. Okay, we got a couple more to do. We're on number 17. We're going to get pressure